Hello everyone, welcome to this series of home remedies for orthopedic problems. I am Dheeraj, a physical therapist, along with my friend Gabbar, are here to again take you to the next range of classes which we are talking about on various joints from the last couple of weeks. So today we're going to discuss on a major issue of the spine. We're going to discuss on two main areas, that is the neck and the thoracic. I didn't want to separate both of them because that will be increasing the number of classes and there's not much to be differentiated between the both of them, because as I told you, the whole spine is linked from up to down. So in order to prevent further logging of the videos, I just thought I'll just combine the neck and the thorax so that it becomes easier for you to understand and link between the neck, the thoracic and the lumbar regions. So today what we're going to see is like the thoracic and the neck. Thoracic, as we discussed, there are 12 ribs in this, and the cervical region or the neck region has got seven vertebrae in this. Now in thoracic, when you talk about, the most important thing is like the structure. It is very stable. As you can see, there are ribs on either sides of the spine. The ribs are basically for protecting the vital organs of our body, mainly the heart and the lungs, and the many other arteries and nerves which pass from the center downwards towards the abdomen. Now we can also see that this flattened sort of a bone which is here, which is attached to the shoulder. Now this bone is called the scapulae, which moves along with when we move our shoulder. So if in case we have a restriction or pain in the shoulder, it could be because of a restriction in the bone of this, which is generally not properly assessed by most of the medical professionals because they don't take this seriously. But this has to be taken seriously. Why? Because if in case you see, it is closely linked with the ribs. So that means a problem in the rib can cause pain in the scapular bone, which can cause pain in the shoulder. Or else a problem in the shoulder can lead to chest pains or rib pains. So here is where we actually need to understand about the interrelationship between the bones of the thorax, the scapula and the shoulder. And now if in case we talk about the muscles, now there are muscles which help in breathing. We all know we breathe in, breathe out. So that is because when you breathe in, these ribs, they expand, they open up, and that opening up is happening because of the muscles which is placed in between these bones. So at times you all might have felt like you turned around and you felt a catch. Now what is that? In winters, especially if in case you are exposed to a lot of cold and then you suddenly sneeze or you suddenly bend, you might feel a very severe sharp shooting pain, which is somewhere in this region. Why does it happen? It all happens because of this muscle which gets cramped. Now you can see the space which is very minimum between the two ribs, and there are very small slender muscles in between them which are long and they pass all along the whole degree of the ribs. So when these muscles go in spasm, it's very difficult to release them, and that is the reason why you have these pains, especially when you take a deep breath. You'll feel a pricking pain happening somewhere. So these are because of the muscle spasm which happens in between them. Second most common problem is these connections between the rib and the spine. You can see very clearly. They are very interlinked in a very technically, I would say, complicated manner, so that it helps in the normal gliding movements of the ribs and also help you when you're bending forward or turning around. So these compound movements which are supposed to be happening are very nicely interlinked and managed. So any disruption in this segment or any tightness in these segments can cause problems in the ribs, and of course vice versa. The problem in the rib can cause problem in the spine. So these two are something which you'll have to again assess if in case you have a pain in this region or if in case it is in the ribs. The next most important thing is like the connection between the scapulae to the thoracic spine and to the neck. The shoulder movements which we generally see are linked with this bone, and this bone is linked with the neck and with the thoracic spine. So any tightness in muscles in this region, which you generally call the trapezius muscles, they are the tight muscle which help us to lift up, and when you're carrying something, they help us support that. If those muscles are tight, then this movement is restricted. If this movement is restricted, it's very natural the neck movement is restricted. If neck movements are restricted, the pain can be here, it can be here, or it can be here. So anywhere. So it's very important for us to differentiate between the problem which is actually in the neck, in the spine, or is it in the muscles which connect them, or is it between the joint which is connecting this bone to the ribs, or is it between the shoulder. So we all must have heard about periarthritis or frozen shoulder. Now frozen shoulder is a very typically used name which is commonly said for patients who do not have the capability of lifting their hands up. So this frozen shoulder is not actually because of the shoulder, or not only just because of this joint between the shoulder and the scapula. It could be the whole area which is leading to frozen shoulder. So when you're assessing or when you're treating a problem with frozen shoulder, it depends upon how much of assessment has been done of these regions. So friends, if in case you are ever having this problem of periarthritis or frozen shoulder, and if your doctor is telling that this is going to take time, yes, it is going to take time, because until and unless we start opening up each and every structure, the movement will not be full. So for some are lucky who get it done in a proper manner for 2 weeks or 3 weeks, but for some unlucky it goes till approximately 9 months to 12 months for this to recover. So it depends upon the structures which are tight and how tight it is. So of course, because this is going to be a remedial class, I really wanted to tell you like how you can immediately understand whether the problem is in the shoulder, the neck, or in the thorax. So let's continue that in the next class. Till then, stay home, stay safe, and have a good time. Thank you.